All right, welcome. Who is this for? Well, I'm Dr. Jason, and this is for anybody who has had imaging, who has had labs, who has gone and had discomfort, pain, and had treatment, whether it be a physical therapy, whether it be surgery, injections, chiropractic. You've done everything. And when it comes down to it, your structure is stable. Your structure is as good as it's going to get, whether that be your spine, your muscles, whatever it is, it's as good as it's going to get. And you've only ever gotten relief for a short period of time. And then it always comes back, that discomfort, that pain, wherever it is that you're dealing with. Well, this is for you. This is exactly who this community is for. The purpose of this is to get the message out there that there is something else that can be causing your discomfort. So, how did HNDC become my passion? Habitual neural dysfunction. Well, we can sound a little funny here, and if you remember those old commercials of the haircut club for men, and he would say, "I'm not only the president, I'm also a client." Well, this was really found out of I was injured myself. I've been a chiropractor. I started out as a massage therapist, and I've been working with the body on the physical structural aspect since the late 1900s. I started in 1997, 98 as a massage therapist, working in a chiropractic office, treating patients, went through chiropractic school, opened my own practice. And then in 2022, all the patients that I saw, I became one of them. I got into a really bad car accident that put me in a position where I couldn't walk for 3 months. There was a massive disc. It's called an extrusion, but the disc basically just all the insides blew out in my lower back, and it was all onto one side, the right side. And that structure compressed the nerves going to my leg. So I lost use of my leg, but the pain that went through my leg and into my low back was excruciating. I had to sleep for quite a few months on my belly with my knees on the floor because it put me in a position that allowed me to have the most comfort, you would say, if it was possible. It was the most comfort I could get into. It put that pain to such a lower level, even though it was still high, that it allowed me to get some rest. Well, I ended up doing injections at the beginning to calm the pain down. And then I went through physical therapy and chiropractic. I did do a surgical consult and chose not to do the surgery. I wanted to see where physical therapy and everything would take me first. Well, months later, this doesn't usually happen, but with my background and being in the field of people that had gotten in injuries, I decided to go do an MRI again about 7, 8 months, about 8 months later. And the purpose of it was so I had a better imaging showing that my disc had reduced from where it was. Well, at that time, when I got the imaging back, the disc had pretty much healed. There was no more compression on the nerve. There was no more issues going on. The therapy had worked. I had avoided surgery. Sounds wonderful when you have an MRI that comes back and says your structural has stabilized, and the issue that you were dealing with is no longer there. Great news. Always great news. However, for the next 18 months, I got up every morning and I had to go through this massive routine of slowly getting out of bed, stretching, hot showers. Some of you may even do this with your cars now. You put the heat on your seat to give portions of your back, make it feel more comfortable because the heat gets on there. Massage guns, lidocaine patches, whatever it is. I've done it to try to reduce that discomfort I had every single morning. So, I mean, you go like that for such a long time and you start saying, this has got to be my life. I'm going to have to wake up in pain like this every morning The structure's stable. There's nothing I can do about it. Well, I had I guess you could say, a conversation with myself, knowing that here I am, I'm a doctor. I've dealt with these issues for years. I've sent patients away when their structure was done and they were probably still dealing with their pain long term. And that's just the way it is. And I said, there's got to be something different. The structure's normal, or the structure's healed and stabilized, but the pain is still firing. Lo and behold, I came across an article that I had known about. I learned this stuff in school, but I came across an article just perusing through things, going down the rabbit hole, and it was about phantom pain. If you've ever heard of phantom pain, it's when somebody has an amputated limb, whether it be a leg or an arm or just a hand. They've lost that structure. It's no longer there. They don't have it, but they still feel pain in that structure. How does that happen? How can you feel pain in something that is not even there? So I went and looked at all the research on it, how people got treated when they had phantom pain. And I'm like, a lot of these symptoms sound similar to what I'm having. The structure's fine, but I'm getting these issues because of my central nervous system. It's known as central sensitization. Because this is a collection of a bunch of other symptoms, and if you take a gander through the website, you'll see a bunch of other secondary symptoms. I was getting rashes that were popping up on my hands. You get the anxiety and depression that goes with it. There's a bunch of other things where the pain moves around sometimes. And it's all about the nervous system. That's the one thing it had in common. Now, there's a lot of therapy that was done for people that have phantom pain, but I was able to say we can take it one step further because you still have the structure, which means the nerve is still connected to that structure, which means there's more things that can be done to get that nervous system to heal. I started doing the at home, do it yourself type of therapies. And very quickly, I started noticing my pain reduction reduce. Well, this was well over 2 years ago. I do my therapies on a daily basis, burn writing, neuromuscular retraining and repatterning, proprioceptive work. And it doesn't take a lot of time, but at the same time, I'm able to jump up out of bed in the morning. I'm back to playing golf. I was able to squat with a bar on my shoulders, and I wasn't worried about what it was going to do to my low back. So the main thing that we focus on is looking at people that have hit that point where the structure is healed. It may not be perfect, but it's stabilized. You may have arthritis. You may have thinning discs. You may have other attributes that are going on. You may have been diagnosed with fibromyalgia, PTSD. All these things have that one thing in common of that nervous system. And if you can calm your nervous system down and get it to rewire and repattern and relearn, you can have a better life doing things that you want to do. Absolutely amazing things that can happen. All right, let's open it up to questions. Gabby, you might be able to even type it in there. What question do you have that could help everyone that has this question?
Thank you, Dr. Jason. I really appreciate you doing this. It's going to be helping a lot of people. I know I really need it. I, as you know, have been suffering with severe neck pain for going on 4 years, had two surgeries. Um, and unfortunately, unlike you, I did have the surgeries. So I'm worried that certain people just say, oh, well, once you have surgery, yeah, that pain is not um, caused in the brain. That's definitely something you have to deal with. I don't know. But like you said, the healing is stable. And been told, it's just healing. You have hardware in your neck. And it's hard to imagine a day without pain. It's
Yes,
life consuming.
I know exactly where you are, and the doubts and the uncertainty and the confusion and hearing things from one person and another. That can be the what I say sometimes the kiss of death. You're going to learn, because I know you're starting to take the program. You're going to learn that sometimes hearing something is the trigger itself. So being told that you're going to be in pain forever, if you hold on to that, you will be in pain forever. If you can say, you know what, I'm not going to listen to what someone else told me. Let's see if we can rewire my nervous system, because it can. And even though you have hardware there, let's see how much that pain reduces or even goes away through this program. You just started this week. This is a good time for you, and over the next 8 weeks, you should notice a big improvement.
Awesome. That would be great.
All right, here's some other questions that I have heard from people in the past. Um, First one, what does what does my doctor say to me that makes me feel that my pain is never going to go away? Well, one of the things is they can say you're going to live with it. This is a part of aging. You don't have to buy into that. Another thing that I've heard before: why does my pain feel worse some days, even when I haven't done anything different? It's very, very common. So your nervous system is hypersensitive, very hypersensitive. Not everyone's, yours specifically, hypersensitive to the rewiring that has happened from trauma in the past. So, with that, any type of stress, a poor night of sleep, any increased inflammation that's going on, maybe from food or anything like that, and it's just a little doorknob that gets turned just slight, and your system is going to respond to that, and you may not even be aware of it. So it's about learning what you're responding to and how to change it. Another question I see: my doctor says my pain is from anxiety. Are they wrong? No, they are not wrong. There is a connection. However, anxiety causing pain and dysregulating your nervous system, that's not entirely true. Anxiety will take an already dysregulated nervous system and amplify it. So there might be times where if you're the type of person that doesn't like your job, and you know you go to work on Monday mornings, Sunday night, that anxiety of going into work, you might wake up with increased pain on Monday morning. How long does it take to actually feel better? I'm going to tell you by week 4. By week 4 is when most people start noticing the patterns changing. By week 4. The first couple of weeks is all education. Week 3 is when we get into burn writing. Burn writing is going to be a life changer for you. I don't know how else to put it. I carry one with me, little notepad, just having the pages. Burn writing is going to be one of the biggest things that you can get out of this, aside from the repowdering, because burn writing you can do anywhere. I've tried everything. Why would HNDC be any different? All right, here's my response to that. Most programs treat the body from a structural standpoint. Some programs teach the mind. It's all in your head, going through mind techniques. However, almost none of them start with the nervous system as its own system. That's where we start. That's the difference. We're starting with the system that connects and communicates with everything. This is about changing the message that your body is running on. If we change the message and you focus on changing the message, the response is different. It almost seems as easy as changing the channel on the TV. If you're watching a program and it's irritating you and you change to a different program and all of a sudden you're not irritated anymore, it seems simple. Well, we've got to change the channel in the brain. We've got to change the channel in the nervous system, the entire nervous system. And finally, is this only for people with stable MRIs? No. If your structure has healed as much as it can and you're still in pain, your nervous system is stuck. It gets stuck in a loop. So we address the part that almost nobody does. How do you retrain your nervous system? So in closing, I'd like to thank everyone that has either showed up to this or anyone that is now watching it in the recorded version. Again, join the free community. It's open to everyone. It's open to everyone, doctors, patients, family members, kids. Get involved. Learn more about how your nervous system is affecting the way you work each day. Should you want to go deeper, there is the 8-week healing journey program. It is almost self-paced. It's week by week, but when I say self-paced, you get to do it from anywhere. You're able to do it from your computer. You can download the school app and do it right on the app. Everything will be very easy for you to get a hold of once you're in. There's going to be new video content that you're going to see on social media on a regular basis. I'm just going to keep talking about this because I know one day it's going to reach somebody that needs it. So again, thank you all for being here. You found this place for a reason.